Hey everybody, John Schumacher here with NewWaveHealthcare.com, and today my guest is Matt Maurer of Stroll Health. And Matt's coming on the show today to talk to us a little bit about something that is sort of a dark cloud in the healthcare industry, which is price, just price, being authentic with our pricing. There's such a dark cloud over our pricing, and having that be transparent is something as a healthcare consumer that you're going to want to know about. So Matt is coming on the show today to talk about that and about his company, Stroll Health. So Matt, thank you so much for coming on and sharing some time with us today. And let's just have you start out. Just tell us a little bit about you personally, your background. We'd like to get to know a little bit about you.
Oh man, absolutely, John. No, thank you so much for having me. Pleasure to be here. I don't know how much time you have. I'll try to gloss over the history of Matt Maurer. Was doing venture capital prior to this. Prior to that, back in school, I was actually an aeronautical engineer. So I, did the logical path of pilot to VC to software technologist to company founder, which got me here. But most recently, before Stroll, I was working for a company called Spoke.com. We were building these really cool business intelligence tools, working a lot with data, cleaning data, finding all these different sources of data that I've never really talked, and surfacing really actionable information from it. So that's kind of my bread and butter and what got me interested into where I am today at Stroll, which is, again, very similar. We're taking data that's never really talked and doing really interesting, actionable stuff with it.
So you have a pretty extensive tech background then, is that correct?
Yeah. So I'm really fortunate. I got to kind of see the process of entrepreneurship from the other side of the table first. So I did a lot of stuff in entrepreneurial finance, worked with hundreds of angels back around the Midwest where I'm from, was involved in a small venture fund, so got to kind of question entrepreneurs, see what they think about and what makes a good business. And so, I didn't really realize the value of it at the time, but to come from that and go on to the other side of the table, be the entrepreneur and try to build a company, it lends some really cool insight that I've been fortunate to stand up on. So yeah.
Perfect. Yeah. So let's talk about Stroll Health a little bit. Boil it down to our listeners so that it's like crystal clear what you guys do. In like one or two statements, what does Stroll Health do?
Yeah, so let me see. My favorite way lately to talk about it is this idea that when we buy things, when people buy things, one of the most important factors that there is price. However, the only service that we buy, as Americans, where we don't know the cost of that service is healthcare. And if you kind of think about it from just that simple sentence, it seems crazy. We buy something, 6 months goes by, and then we find out the cost of the thing we bought. And if you look at how we got here today, it doesn't actually seem that strange, but the fact that there were all these other options and the different cost of all these different options, when you actually learn what you could have gotten or what you should have gotten, or why what you did get cost so much, it's quite a shock. So we want people to see the cost of something before they buy it in healthcare.
Perfect. Yeah. So you guys, so to boil it down, you guys basically, lift the veil of the healthcare costs. And can people search locally for providers and then compare costs, or is that part of the functionality of your app?
Yeah, there's definitely a search component. So we have we can kind of go into the uniqueness a little bit later on if you want, but one of the elements of Stroll is we surface these costs to the patient at the moment when they're with their referring doctor. So just think of your general doctor, your primary care physician. The moment that you're with that doctor and you know what you want to do next, that is the moment that we surface all of these options. And so then with that sort of authoritative medical, your trusted advisor, you can say, MRI, right? That's what I want to search on. I need to get an MRI and check out this procedure. Then we say, oh, did you know that there are 39 facilities around the Bay Area where you could do that? And here's what each one would cost you out of pocket. So the search actually kind of happens as an accident, right? We just show you all the options, and we don't want patients to really have to filter too deep into it. So, because it can all get very confusing very quickly. So we just try to let you search by way of using the app itself.
And so, does your app integrate with other insurance companies and stuff? Because they're the ones that are ultimately driving a lot of the cost and stuff like that. Like, how does that work for your end?
Yeah, one of the biggest pieces that we need in order to do this is the pricing component. It comes from various places, but one of the biggest being the insurance companies. How much they charge for various procedures, and then we have a system that allows us to kind of ping that against how much has this patient paid in for the year, what does their insurance plan look like, and so you actually have to kind of tell us, this is the insurance company I use, and then just a tiny bit more information. Then we can put it all together for you in a nice little package.
All right, sounds good. So what inspired you to create this company? And did you have a personal vendetta against healthcare costs, or what inspired you to do this?
Well, I mean, if you read a few news articles today, it's easy to get motivated and angry about the state of healthcare. My personal interesting story that kind of let me tie it all together was right when I moved to California, I hurt my knee playing hockey really bad, and I had to go find a doctor. I actually used Yelp for it, which was kind of weird. But I was told, here's the process. You get an MRI, then we'll probably have to do this. We'll go scope your knee, slice in, clean it up, stitch you up, put you back on your way. And I was like, well, I'm new here. How much does this cost? Rent is crazy. I ended up calling my older sister, who is she's a physical therapist out in Kentucky, and she said, hey, you know what? You're probably not going to be able to afford this, right? You have horrible insurance. And I just leveled with it. I was like, listen, if I have to go pay for all this stuff, I'll probably have to move back to Minnesota and then get a quote unquote real job. And so only by virtue of having her as my advisor was I able to kind of find out what this should cost, where I could get it at a reasonable rate. And I actually stopped at an MRI. She just said, listen, you should just wait a few months, right? I'm not giving you advice as a doctor. I'm your sister, so that's who I'm talking as. And you should just wait it out, see if it heals itself. And it did, and I didn't have to pay all that money, and I got to stay, but it was only by having access to this information that I feel like most people don't. So that was a pretty big genesis for me finding this as a compelling area to work with.
Oh man, it just makes your blood boil. You're like,
Yeah.
come on, right? It just drives you crazy. I
Yeah.
was speaking to you before the interview. We talked about there was an article in Med City News that talked about that, and I think the price of a pacemaker was like $20,000 at one hospital, and almost $80,000 at another. It's like what? It's like the same service almost. It's almost like these companies can just charge what they can get away with, and there's really nothing to stop them from doing that. Would you agree?
Yeah, no, you're totally right. It's kind of a virtue of the way that the system has evolved over time, and the stuff gets really crazy is when you learn that the $20,000 pacemaker is across the street from the $80,000 pacemaker, right? and then you learn the $20,000 pacemaker, it could be a better pacemaker than the $80,000 pacemaker. Like there's no quality component that's necessarily tied. There's not even like a geography. It's just crazy. Yep, we could go on for days.
I know. I mean, we only have so much time here. We could just start ranting about this forever. But
Yeah.
so we've sort of already done it. But in your eyes, paint the picture of the problem that you're trying to solve. I mean, a little bit more detail. Paint the picture for us.
Yeah. So I mean, the biggest view of the picture is that American healthcare is screwed up in all kinds of different ways. And pricing is one of the biggest ways that it's messed up, and there's so much waste and bloat in the system, and that leads to other systemic problems. So we figure if we can create a way for patients to just make the optimal decision for them, right? Let me answer your question, right? The simplest version of the problem is that a patient doesn't know how to make the optimal decision, which is just basically, this is the procedure that I should get. Here's the cheapest option that's still the good enough quality for me, and I'm not like harming myself in any way. But patients don't have the information to make that optimal decision, and if we can just show it to them and say, what you do with it is fine. You can keep going the way you've always been, but if we just show you the information and let you enter that into your decision-making process, like we can eliminate so much waste and bloat from the healthcare system as a whole if we can do it systemically. So that's what we're tackling.
Yeah, and that's a great mission, man. I mean, they need something like that because it's ridiculous out there how much that we're getting charged for our procedures and for the same thing. And in the United States, it's just a glutton of payment and overpayment, and I mean, our costs are the highest, yet our outcomes are not at all near the top of other countries and other civilized countries. So it's just it's an obvious problem
Yep.
that I'm glad someone's going after. So.
Oh, you got it.
So tell us a little bit about. I know there's other companies out there that are tackling this price transparency issue that we have in healthcare. What really separates you guys, Stroll Health, from some of the other companies out there?
Yeah, it's a great question, and you're right. There are. The further that you dig into this, you find out there's a lot of people that have said this is a real problem. Let's solve it. And I mean, there's dozens of different ways that people are going about it. And so, kind of the piece that makes us the most unique, and what we kind of stand up on is we want to deliver this solution to the physician, right, to the doctor, which is kind of unique. It's more just by the way that we're geared as a company, as a management team, the people we have around us, and what we think we can affect, how we can have the greatest change. So we want to build something that the physician would actually pull out when they say, okay, I've done all my diagnosis, here's what I think is up. Maybe I want to get more information with a diagnostic. Maybe there's a simple lab I want to have performed for you. Maybe I just think that it's time for you to go see a specialist. We want the physician to say, okay, I want to continue helping you make the best decision for you, right? You're my patient. I care about you as a person. So here's let's look at some basic options, and by using this tool, I can show you what each would cost you out of pocket. And the reason that we're taking this route is we have this belief in shared decision making. So this idea that a patient can be empowered while they're talking to their physician in that moment, and they can kind of collaborate together, right? They have like their coach. Healthcare is scary, right? It's my body. I can get freaked out about it. But a couple writers have put this really eloquently, where they say the one symptom that, or the one side effect of healthcare that isn't being considered today is cost. If we think of cost as like a financial symptom of just going through the motions of healthcare, that should be factored in along with other things, so that there aren't, because there are real life consequences to people not considering costs. I read just the other day there's like 2 million medical related bankruptcies in America like every year, something like that, which is just crazy.
Wow.
So there is a real financial implication to not knowing costs, and that's what we want to get to. So that's why we give it in the hands of the physician.
And so other companies aren't doing that, or not that you're aware of. It's mainly just focusing on providing information to the patient. Is that
Yeah,
correct?
the most common thing that you see is to build a tool for the patient to directly, which is just again kind of like not our bread and butter, not our focus, but I think there's actually great companies doing really really great things in that way, where you can get these really cool mobile apps. And I go and download all of them, right, because this is just what I'm passionate about. And there's really great websites where you can search by a zip code or by a symptom and kind of get an idea for estimated costs that are around you. And so I feel like we're all kind of chipping at it in different ways, and honestly it's going to take a lot of
Yeah.
us to be successful to do something.
Right. Yeah, it's going to take the village to solve the problem there,
Yeah,
probably. But
exactly.
it's cool that you're a part of it and you guys are excited about it and providing good solutions there. So, how are you getting in the hands of these doctors?
Yeah, so we found out that historically doctors and adoption of technology has been really tough, but a lot of that is changing. There's some really cool stuff that companies have done before us to build apps for doctors, things they can get on an iPad, on an iPhone, just the whole EHR
Hmm.
system in itself. So what we want to do is we want to build this on an iPad. We found that for what we're making, we think that's the most logical platform for a doctor to pull out an iPad in that moment, because it kind of fits with other models that they're currently doing. And then if we can, we're going to give them to them for free. So that one hasn't been fully fleshed out, but we would love to just offer doctors free iPads, free downloads of this app, and just say keep doing all the amazing stuff you're doing for patients. Just add this one thing in.
So offering it for free then basically to
Yeah.
anybody. Okay. And so
Yep.
so what would be your business model then behind this whole the whole thing?
Yep. So we want the physician and the patients to be our users, right? Primarily the physician, and then use with their patients, and then the actual customers, the people that pay for it. That is more of like an insurance company, a
Mm-hmm.
large hospital network, an ACO type. There's basically anybody that's fronting the majority of the cost also has a lot to gain, and so we're kind of chasing that down as the customer and the people who pay for it.
So your ideal customer then, as far as revenue and things like that, would be insurance companies, large organizations,
Bingo.
not 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 the not the consumer, not the little guy. They're going to get a free access to that.
You got it. That's exactly right. Yep.
All right. Perfect, perfect. Well, share with us a little bit about something that you're excited about that's new that's coming out for you guys. I know you said you guys were still, I believe, in beta, right? So, share with us something that's new or that you're excited about with your company.
Yeah. So we let's see. I think the newest thing and most interesting thing that's happened in the last few weeks is we set out to find a like a physician advisor, right? Someone who could kind of fill that role because we had we targeted that's what we wanted to build for, and almost accidentally we gathered up a team of about 8 physicians, right? Almost because we just pinged a few and they told their friends and other people wanted to be a part of it. So now we have this like amazing group of medical advisors that we're just reaping the benefits of now because they have so much experience in, they actually deal with patients day to day, so they can be like, no, this is how I use it in my office. I understand you guys want to do this. This is how I use it. And so we can kind of circle back, and we've actually changed functionality of how this app will work by virtue of the accidental large group of physicians that are now advising us every day. So that's really exciting for us.
So tell me a little bit about your team. Like, what did you guys all launch? Did you launch as a group? You're the COO, right, of the company,
Yep.
I believe. So did you guys just know each other, got this idea together, and launched this thing together, and then just started reaching out and asking questions within the healthcare community, or how did that start?
Yeah, so it's been seeded for a while, probably a year and a half. The CEO, he's been closest to the healthcare industry for a while. He's actually built like performance management tools, some really really complex software
Hmm.
for larger clients, some of which are major insurance companies. So he's kind of got like the onus, the genesis of it, and then I've known him for a couple years. And then the 2 other guys also knew him, and so for probably a year we've been kicking around ideas and planting seeds about how we thought we could be impactful. We all have technology backgrounds, but they're pretty diverse, so we kind of see things in this industry through different lenses. And then it all came together last year um, when we entered a competition that was hosted by a bunch of healthcare executives and insurance companies, and we went through this sort of week-long process of ideating and putting together what we thought was the best, possible version for a company. We won this competition, raised a little bit of money that way, and so very quickly this kind of just took us for a ride. And so now the 4 of us, we have the CEO is working on it full time. I'm working on it full time. We have a great designer working on it part time, and then our CTO engineer is working on it part time as well. And then we just keep adding advisors to the mix. So that's kind of
Perfect.
where we are right now.
Perfect. That's exciting. That's really exciting, my friend.
Yeah.
So just as we wrap things up, just tell us any closing remarks you'd like to say about your company, and then share the best way to get a hold of you for our listeners.
Yeah. So I mean, we're one of the most interesting things about us as a company in the healthcare space is that none of us directly come from healthcare, right? Before my CEO was doing building software around the space, he was working at nuclear power plants. So we all have these really like interesting, diverse stories, which I think it's kind of that special sauce that allows us, in true Silicon Valley fashion, to kind of take a fresh look at an industry. You get a lot of friction when you come to an unknown place and try to learn a lot, but we're all still in this learning phase, and we've recently come to the point where we are really wanting to partner, like really wanting to find that first batch of insurance companies, of large provider networks, really anybody that kind of fills that payer role, and like talk to us, right? Like let's exchange ideas. Let's show you what we can do, because the software is now, everything's built and ready to go, and we have some initial like test cases already playing. So I think closing remarks, right? Very self-serving from a company standpoint, but if anybody is interested in learning more, we are always willing to talk. You can get a hold of me. Check out the URL, which is strollhealth.com, STROLL, just like it sounds. And then my email address is matt@strollhealth.com. But I mean, we want to help support the community and everybody that's coming up that John's going to be talking to in the future. So just
You
feel free
bet.
to reach out and let us know.
Sounds awesome. Thank you, Matt, for coming on the show. We really appreciate your time today, sharing your story and talking about this issue that's frankly just it gets your blood boiling, but it's something that you guys are working on, and I commend you for that. So
Absolutely.
Thanks for your time, my friend. And everybody, hope you enjoyed that conversation. As always, you can check us out. The archive for this talk here will be newwavehealthcare.com/Matt Maurer. Or you can just go to the search bar and type in Matt, enter the looking for an interview search bar, and his show notes page will pop up right away. And again, we'll have another interview next Monday at 4 p.m. Pacific. We're going to have another great entrepreneur in the healthcare industry sharing their stories and giving you all some tidbits to help you expand your knowledge within the digital health and entrepreneurship industry. So take care. I'll see you then.
Thanks, John.